Good morning. This is Dr. Roopa Seshadri. I'm a vascular interventionist. I work in Fortis Hospital in Bangalore. So we will talk today or discuss about peripheral artery disease. What is peripheral artery disease? People have pain in their legs. While walking for some distance, they get pain. And this progresses to an extent that even when they are standing or sitting, this pain is there. Some people after this pain develop redness, wound formation, the toes of the legs will become black, called as gangrene. So all this is a part of peripheral arterial disease. Now what happens is, if I have to explain, in our house, water comes through water pipes and we use the water and it goes away in sewage system. So when there is a problem in the water pipe, when there is narrowing of the water pipe, then the water to the house reduces. When the narrowing becomes much more, the water to the house decreases much more, and we cannot do any work which uses water in the house, like we can't cook properly, we can't take bath. Similarly, our legs require blood, and this blood flows through blood vessels. In other words, similar to water flowing through water pipe. So when this blood goes through blood pipes in the leg, it supplies the nutrition and oxygen to the legs. So when the water pipe, which is similar to which is actually a blood pipe, becomes narrow, then the water supply, that means a blood supply to the leg, reduces. So when this reduces, the legs cry out of pain. They say, we want more blood, more nutrition and more oxygen. So that is when the patients begin to feel pain while walking, and when it progresses even during rest, there will be pain. And when this reduction of blood flow increases because of more narrowing of the blood pipes, patients develop wound in the legs and gangrene in the legs. So what all causes this narrowing of the blood pipe? Patients who have uncontrolled diabetes or sugar disease, patients with uncontrolled hypertension, patients who smoke a lot. There is chemical contents in the smoke which goes and it damages the blood vessels of the legs all over the body, and when it damages the blood vessels, it begins to narrow. That is when the blood supply reduces. And even with people who have high fat content in the blood, called as hyperlipidemia. What happens in diabetes, hypertension and hyperlipidemia and smoking? The blood pipe gets damaged from inside and it begins to narrow. And that is when it becomes narrow and completely closes off. So when patients have these problems, they should consult a vascular interventionist. Now these kind of interventions were done with open surgery. Nowadays, they are not done with open surgery. We use just what is called as pinhole surgery, or we make 1 to 2 millimeter incision in the leg and we go inside the water pipe. When I say water pipe, it means blood pipe, and we open it up by we put a balloon and we open this up like this, so that increasing the blood supply to the leg. And if required, we might also have to put a metal tube inside to hold that, to keep it open. So this is called as peripheral arterial intervention. And with this, the blood supply increases to the leg. With this, more nutrition, oxygen reach the leg, and the wounds heal, the pain reduces. So whenever you have if you're a smoker, diabetic, hypertensive, or have hyperlipidemia, and you have any pain in the leg or wound in the leg which is not healing, or while walking for certain distance you have pain and you have to stop walking, all this indicates that the blood pipe in your leg is problematic, and this can be treated by minimally invasive interventions. So reach out to interventional radiologists who are specialists in vascular diseases.